Okay, so now we go back to our simple example and we can look at the cost of illness for our case study. So, the cost of illness of an intervention would show how an intervention would reduce the cost associated with an illness, a disease, or a condition. Example of cost categories for intervention cost of illness are treatment cost, income loss due to missing work days, or the diagnosis cost. If these are not reduced, why do the intervention? What's the point? But remember, we have to take into consideration the perspective. That's very important. It determines the cost that should be included in your analyses. In our syphilis example, the clinic perspective does not include the cost of illness because the clinic doesn't normally pay for treatment, hospitalization, or diagnosis of symptomatic syphilis. So preventing cases would not reduce these costs for the clinic. However, if we take into consideration the patient perspective for this evaluation, or even the societal perspective, we would include them because the patient pays for these things normally. Avoiding them by early screening and treatment will actually reduce the cost to the patient. A societal perspective also considers all these costs, and this includes all the patient's costs. Now, in some situations, the clinic, or if you're doing the evaluation at the hospital, you have to take these costs into consideration. For example, in Zambia, they're trying to reduce neurotube defects. And if a child comes into the clinic, the government pays for all the child's medical expenses and surgeries and stuff like that. And so there you would include the cost of illness if you're looking at it from the hospital's perspective. So, infant born with syphilis, and we look at it from their perspective, there are a number of different types of costs that we may have to include. And these are just some examples. So you could have inpatient and outpatient costs. And you have a number of different types of treatment or care related to that, such as the clinical care that's provided, the rehabilitation care, transportation costs, especially if we're looking at it from the patient's perspective. And then maybe some costs due to the mother not going to work, having to stay with the child during the treatment, or even just driving the child from a remote area to the hospital. That could end up causing the mother some income that she could be earning if she didn't have to do this. So all these different types of costs you would include if you were looking at it from a patient's perspective. So you will also include these costs if you're looking at it from the societal perspective. But for our example, from the clinic perspective, we don't include any of these costs. So that's the end of our example. And again, if you have any questions, please do not hesitate to contact your mentor. Thank you.